I'm Raisa Zalini, the CPT coordinator for Oxfam, and I'm here to introduce you to the Community Perception Tracker, CPT, a new approach that we've used in the field throughout COVID-19. So there's a huge amount to say about the CPT, but here's going to be a really brief snapshot of what it is, how it works, and some lessons learned along the way. There's a lot more information on our dedicated CPT webpage, the link at the bottom of the poster, which includes some full case studies. And later this week, you will hear also from the London School of Hygiene and Tropical Medicine, some great learnings from our research project on the CPT. So the CPT is very much part of our Oxfam community engagement approach. It was developed in 2018 and tried in DRC during the Ebola outbreak. And then it was adapted to COVID-19 last year and implemented across 5 different regions. The important thing to note about the CPT is that it's not a standalone approach. It should be implementing alongside existing program activities. It's a mobile tool that allows staff to collect real-time perception for crisis-affected community. So as you can see here on the diagram, the way it works, it's an ongoing cycle. So starting with collection of perception on a mobile phone or tablet, face-to-face or remotely, the data collected is analyzed, correlated with epidemiological data, and then it's used to make meaningful adaptation to programs and also to provide evidence based for advocacy and influencing. So you can see the individual step on the process in the diagram here. On the case study, we have included here some examples of how it works, how the data is captured, and what it looks like in an analytical format. We have done some dashboards, developed some dashboards. So it is more than just taking the pulse of the community, as described by one of our CPT champions, because it allows us to make some programmatic changes in correlation to what people are telling us. So in Bangladesh, for instance, the early perception captured last summer were really focusing on the existence of the virus and whether NGOs were disseminating fake news. So what we had to do was to work more closely with trusted community leaders to establish the importance of early testing. And we adapted our community dialogue to explain safety measures and discuss at coordination level to ensure that staff were following the safety measures. In Venezuela, the public health messages encouraged people to go to hospital to get tested. But the CPT revealed that there were fear associated with hospital, especially for the migrant population. And therefore, we had to modify our approach and focus on prevention and shielding for people who were really not ready to go to hospital. In Venezuela, we have to say that the CPT has played a really important role in shaping our strategy response by providing a data where there has been an epidemiological silence for years and lack of coordination mechanism amongst humanitarians. We've documented all of it in our full case study on Venezuela. So some of the highlights and challenges about the past years are common to all the countries where we have implemented the CPT. So I'll just touch upon a few. The CPT is not just a means of collecting data. It really is a process that allows us to transform that data into action. The true essence of it is the ability to enable meaningful programmatic changes that can really play a role in building a trust with communities. Another aspect is that that process creates a space for all the team from different sectors and partners to come together and discuss real-time data, trends, and make coordinated recommendation and action. In terms of challenges, well, COVID has provided plenty, particularly given the all mobility restrictions. But I would say that some key learnings have been, although that the CPT is a simple approach, but it requires a significant change of mindsets. We're not here to ask questions. We're here to listen to people. And we're here to also use qualitative data on a regular basis. So to build this confidence of our team, it will take time and resources. So our next step will be to increase our monitoring of the use of the CPT to gather more evidence of its usefulness. We would like to consolidate the learning to improve the CPT process and tool, and we are going to develop the CPT to suit other types of crises, especially for countries where COVID-19 is not a priority anymore. So to conclude, I'd like just to add that we have learned a huge amount and since we first developed the CPT, and that the CPT has not yet unfolded all its potential. So we've documented all the learnings in our website at the bottom of the poster. Thank you so much for listening, and do reach out if you have questions.